everybody. I'm Marika Walsh. I'm your moderator for the press conference today. We have with us Prime Minister Justin Trudeau and Health Minister Jean-Yves Duclos in Ottawa. Please remember that we will have half the questions in the room and then half the questions on the phone line. We have a total of 25 minutes for questions, and there will be 12 minutes in the room first. We'll go to the Prime Minister now for opening remarks. Thank you.
Merci beaucoup.
Thank you very much.
Content d'être ici aujourd'hui.
Hello, everyone. I'm delighted to be here today, accompanied by our Health Minister, Jean-Yves Duclos.
News on keeping Canadians safe, so I have a few updates for you here today. First of all, on treatments. On therapeutics, Monday, Health Canada approved the antiviral Paxlovid. It's an important new tool in our toolkit that will protect against severe outcomes, hospitalization, and death. We have a contract for 1 million courses of treatment. We've received our first shipment, and distribution to provinces and territories are underway. It's important to remember that this will be a powerful tool to continue to keep people from getting extremely sick, but it needs to be used right, and it's not a replacement for getting vaccinated, for wearing masks, for staying safe, for keeping your distance, for doing all the things that need to keep us safe from the beginning. It's just an extra layer of tools that we can use as we move forward through this pandemic. Sur les vaccins et les tests.
With regard to vaccines and rapid tests, we now have enough doses so that everyone can be vaccinated and even receive a booster dose. So there is no excuse. People must be vaccinated. That's how we'll get through this. And I'll remind you once again that you don't need to be shy about going to get your first dose. The nurses are there to help you for to receive your first dose. They'll be happy to welcome you. They'll be happy to give you your first dose, even in January 2022. They'd be much happier to do that than to treat you in ICU.
To get vaccinated, to get their booster shots, so go do it. No matter how you may feel that you're late, better late than never. It's never too late to do the right thing. And the health worker who will be helping you get vaccinated would much rather be giving you a vaccine than intubating you in the ICU. So please keep doing what is right. At the same time, we know as we get back to school, as kids are re-engaging, parents are worried about the health of their kids. Therefore, get them vaccinated. The vaccination rate for kids 5 to 12 is too low in Canada, which means not only are kids more vulnerable, but all of society, whether it's teachers, whether it's grandparents, whether it's frontline health workers risking getting overwhelmed when those people start to get sick. We need to do what's right. We need to continue to do the right thing. That means getting our kids vaccinated. It is safe and effective and the right way to get through this pandemic. Another tool, obviously, is rapid tests, which are extremely important during this wave of Omicron. We are purchasing hundreds of millions of rapid tests and sending them to provinces and territories for distribution to Canadians. Getting tested regularly is an important part of how we're going to stay safe. But again, it's no replacement for getting vaccinated, for getting your booster shots, for getting our kids vaccinated. So let's keep doing that. The hardship of this pandemic is felt by small businesses, by workers, by folks across the country in our economy. That's why we're continuing to step up. We made a promise in the beginning of the pandemic to have people's backs, and we have. There are direct income supports for people who lose their jobs or are laid off, but there are also a wage subsidy for businesses to be able to keep people on the payroll so that we can come roaring back quickly when this current wave is done. Keep people tied to their job. These are the kinds of tools that we have that work best. So the wage subsidy, the rent subsidy, the supports we have for people are there to be used. They will be there for all hard-hit businesses through this wave. Please make use of them. The federal government is there to help. Mais on sait très bien.
But we know very well that with all we're doing here in Canada, this pandemic will not end anywhere until it's beat everywhere. And we've seen that with Omicron. We'll continue our international efforts to provide access to vaccines across the world, to provide medical support. That's why earlier today, Minister Sajjan highlighted the 1 billion doses delivered by COVAX to date to countries around the world. Canada will be giving 200 million doses by the end of 2022.
From the very beginning, one of the top donors, including global vaccine donors, and has played a leading role within COVAX and the ACT Accelerator and various mechanisms to make sure we are getting vaccines out to the world and supports to be able to get those vaccines into arms around the world. We're also moving forward on specific supports to develop access to vaccines, including, for example, $15 million to South Africa to develop vaccine manufacturing. We will continue to step up, but we also know that other countries must do the same. We'll continue to work with our partners and friends around the world to encourage people to do that. Speaking of international issues, before I finish today, I do want to touch on the situation in Ukraine. Yesterday, I spoke with ministers and the Chief of Defense Staff and a range of officials on an update and a strategy session around Ukraine. Minister Joly joined the call from Ukraine, where she met with President Zelensky and other top officials and reiterated Canada's steadfast support for the people of Ukraine. We are there as friends and allies. We have a military mission there, Operation Unifier, and Minister Anand has been talking about that. We are there to support and train the Ukrainian troops. And we're working with our international partners and colleagues to make it very, very clear that Russian aggression and further incursion into Ukraine is absolutely unacceptable. We are standing there with diplomatic responses, with sanctions, with a full press on the international stage to ensure that Russia respects the people of Ukraine, respects their choice to choose their governments and their direction. We will always be there for the people of Ukraine, and Canada will continue to stand with our allies in defending our friends in Ukraine. Avec le temps froid,
with the cold weather, snowstorms, dark, shorter days, I know that it's difficult for people to get through this across the country. We've just come out of a large snowstorm, an important snowstorm in Quebec and Ontario, and I understand that people are exhausted. We have gone through 2 very difficult years, and it's not over yet. We're worried about our health, the health of our loved ones, the economy, the health system. There is a lot of anxiety, and a lot of people are feeling anxious. That's why it's so important to continue to be there for each other, to have each other's back, especially when it comes to mental health. We've had many crisis situations that people have had to go through, and we need to be there for each other. That's why we've launched the new Pocket Well application to help people find support when it comes to their mental health.
Pocket Well app that I encourage you all to download onto your phone. It is an extra tool that the Government of Canada has put together to help people access resources for mental health and wellness, to help people be there for each other, and to make sure that people know that we're going to get through this by leaning on each other and by supporting each other. It's what Canadians always do when we're at our best, and the difficulty of this pandemic has brought out the best of Canadians as we continue to step up for each other. So please be thoughtful, be engaged, be supportive, listen to people, know that young people are facing real challenges around mental health. The elderly, again, are facing isolation and challenges, and we're all in a time of stress and anxiety. The more we can be there for each other, the better off we'll be as we make it through this. Merci tout le monde. Je suis maintenant très heureux de
Thank you, everyone, and I'm pleased to give our Health Minister the floor. Thank you, Minister. Prime Minister, rather. Hello, everyone. Before beginning, I'd like to take a moment to recognize the COVID fatigue that we see and feel everywhere. Everyone is feeling the effects of 2 years of pandemic living. So it's not surprising that nearly half of Canadians reported that their mental health has worsened during the pandemic, and that includes 7 out of 10 healthcare workers. That's why last week, my colleague, Minister Bennett, announced a new application, PocketWell. This is a companion app to the Wellness Together Canada portal. Using this app, Canadians can connect seamlessly to the Wellness Together portal for free and confidential virtual sessions with social workers, psychologists, and other professionals. As of January 10th, 2022, more than 2 million people across Canada have accessed the Wellness Together portal in almost 6 million web sessions. And while we are thinking of how to help Canadians maintain their mental health during the pandemic, we are also focused on fighting off the current of COVID-19 across the country.
Like the Prime Minister just did, that the COVID-19 fatigue is everywhere, and we feel it and see it everywhere in Canada. Everyone is feeling the effects of 2 years of pandemic living. So it's not surprising that nearly half of Canadians reported that their mental health worsened during the pandemic, including 7 out of 10 healthcare workers. That's why last week, my colleague, Minister Bennett, announced a new application, PocketWell, which is a companion app to the Wellness Together Canada portal. Using this app, Canadians can connect seamlessly to the Wellness Together portal for free, confidential virtual sessions with social workers, psychologists, and other healthcare workers. As of January 10, 2022, more than 2 million people across Canada have accessed the Wellness Together portal in almost 6 million web sessions. And while we are thinking of how to help Canadians maintain their mental health during the pandemic, we also remain focused on fighting off the current wave of COVID-19 across the country. Comme vous le savez, Santé Canada.
As you know, on Monday, Health Canada authorized Pfizer's antiviral treatment Paxlovid, paving the way for the distribution of this potentially life-saving medication. It will be used to treat adults with mild to moderate COVID-19 who are at high risk of progressing to serious disease. Paxlovid is available by prescription and comes in pill format, so it can be taken at home. This will help ease some of the pressure on healthcare systems. Canada has pre-purchased 1 million treatment courses of the drug, with the first shipment of 30,000 to be distributed this week on a per capita basis. That is distributed to the provinces and territories on a per capita basis. Each treatment course will treat 1 Canadian. We are also expecting another 120,000 treatments in February and March.
Canada authorized Pfizer's antiviral treatment, called Paxlovid, paving the way for the distribution of this potentially life-saving medication. It will be used to treat adults with mild to moderate COVID-19 who are at high risk of developing a serious disease. Paxlovid is available by prescriptions and comes in pill format, so it can be taken at home. That will ease some of the pressure that we see on healthcare systems. Canada has pre-purchased 1 million treatment courses of this drug, with a first shipment of 30,000 to be distributed this week on a per capita basis. Each treatment course will treat 1 Canadian. We're also expecting another 120,000 treatments in February and March. La nouvelle de ce...
This is welcome news for Canadians, especially at this time when many of our country's hospitals are overwhelmed with COVID cases. Though the risk of hospitalization is lower for Omicron, the sheer volume of cases will likely increase hospital admissions. These forecasts underscore that we must continue to exercise prudence in order to limit the coming surge and protect our healthcare workers. No drug, including Paxlovid, is a substitute for vaccination and following public healthcare measures. I'll say it again, or rather, 35% of Canadians have received a booster dose, and 78% Canadians, no matter what their age, are entirely vaccinated with 2 doses. However, we must continue our efforts regarding vaccination so that we reach complete vaccination.
Is obviously welcome news to Canadians, especially at this time, when many of our country's hospitals are overwhelmed with COVID cases. Based on recent modeling data, we can expect Omicron cases to continue to surge across the country at a very high level while monitoring for a potential peak in the coming weeks. Though the risk of hospitalization is individually lower for Omicron, the sheer volume of cases will likely keep increasing hospital admissions. These forecasts underscore that we must continue to exercise considerable prudence in order to limit the coming surge. No drug, including Paxlovid, is a substitute for vaccination and following public health measures. On the vaccination front, the situation is encouraging at the national level. 35% of all eligible Canadians have now received a booster dose. 48% of children ages 5 to 11 have received their first dose. And 78% of all Canadians of all ages have received their primary 2 doses of vaccination. This being said, we must continue to accelerate our vaccination efforts to trend towards universal coverage. Ceci étant dit, bien que les mesures communautaires soient nécessaires en raison de la flambée,
Although community measures are necessary because of recent outbreaks, we need to continue. That means we need to continue to wear masks, physically distance from others, and above all, get vaccinated and even go and get your booster dose when you're eligible.
measures are necessary given the current rapid growth, it cannot overstate the importance of individual practices. Let us continue to wear a mask in public places. Let us continue to limit our contacts. And most importantly, let us get vaccinated and, if eligible, get boosted as well. Merci. Thank you.
Okay, thank you so much. Just a reminder for the journalists who joined us in the room, we will have 12 minutes for questions in the room and then go to the phone line. Please remember that if you ask for French and English translation, you will lose time to ask questions. And if we could keep the answers brief, then we can get to as many questions as possible. The first question will go to Kevin Gallagher, and then it will be Laurence Martin. Please go ahead.
Good morning, Prime Minister. Inflation's really at all-time highs, highest since 1991 for an annual rate. This is putting pressure on prices for food, gasoline, bottom line for businesses, and government spending. And increased government spending during the pandemic certainly has helped fuel these high inflation rates. So what is the government's plan to try and combat it this year?
First of all, through this pandemic, we've had Canadians' backs. We've been there to support them with wage supports for people who lost their jobs, with supports for small businesses, for workers, for families, for seniors. And that's part of why we've been able to make it through this pandemic as well as we have, despite all the tragedy and loss. We will continue to be there because we came into this pandemic one of the best fiscal positions of anyone in the G7, and we continue to have an extremely strong fiscal position. The inflation challenge that the world is facing right now is a global challenge linked to, obviously, this pandemic and the path out of it, but also linked to significant disruptions in supply chains around the world. That's why we're continuing to work to be there to support Canadians. Just last week, I announced that families in Nova Scotia are going to save hundreds of dollars a month as we've reduced childcare fees because of investments we made across the country, and other places like Alberta and Yukon are also seeing significant reductions in those prices for families. We'll continue to move forward on supports in terms of housing, in terms of supports for workers, supports for families, because we recognize that rising cost of living and the prices of groceries and gas is a real pressure and stressor for many, many families.
So what should we take from that? Is this something that we will anticipate? It sounds like that's more government spending, that's more stimulus, that's more aid for people. But in the 2021 economic and fiscal update, the government seemed to step away from any references to fiscal guardrails or winding down the stimulus spending that came from this pandemic. So what should we make of that? Is this the foreseeable future where inflation rises, but where is the check and balance in terms of the fiscal guardrails and reining in the stimulus spending that was necessary during the pandemic, but is now exacerbating the inflationary situation Canadians find themselves in?
Actually, Kevin, what you'll find when you look at our fiscal projections is an indication that the debt to GDP ratio needs to continue to decrease in this country. And that's something that we've always put forward as a sense of fiscal responsibility, that the size of our debt in relation to the size of our economy needs to continue to decline. And it is doing exactly that. But at the same time, yes, as you point out, we are making the choice to be there to support Canadians, to have their backs, to support seniors, to support families, to support small businesses, to support workers. We're going to continue to be there to support Canadians because we know that helping each other out is not just the best way to get through this medical challenge, this pandemic crisis. It's also the best way to make sure our economy comes roaring back as strongly as possible. And that's actually something we've seen when we were quicker to recover the jobs lost during the pandemic than the United States was, for example. We've seen our economic growth numbers strong, and indeed, we're going to continue to be there to make sure we're supporting Canadians so that, yes, they can handle the challenges around the rising cost of living while at the same time get through this pandemic.
Go ahead, Tom.
Hi, Prime Minister. Tom Perry, CBC. Since the pandemic began, we've seen some politicians facing increasing threats. Their homes are being targeted, their families. What do you think needs to be done to combat that? And do you think that your legislation to protect healthcare workers and patients could be extended to protect decision makers, politicians?
Nobody in the course of doing their job should be faced with threats of violence, threats to their family, and that applies for healthcare workers or for politicians or anyone else. And we recognize that mental health stresses, economic stresses, issues around extremism and protests have created a dynamic where there are more threats to people serving the public than before, whether it's doctors or public health experts or politicians. Our responsibility as a government is to continue to make sure we're keeping all Canadians safe, and that includes people who serve at all levels. And that's why we continue to engage with public security, with police services to ensure that we're doing everything we can to protect Canadians. But we haven't, at this point, looked at similar legislation. I think the focus on health workers was one that everyone understood was necessary. I think we need to be very thoughtful about how we make sure that everyone else is safe as well.
And on Ukraine, the Ukrainian government has been asking Canada for defensive weapons. And I know that some of our allies, the UK, the US, they have provided weaponry. Others have been reluctant. They don't want to provoke Russia. And I'm wondering what's taking us so long to make a decision. Is it a case where we don't want to antagonize the Russians on this?
I think one of the things that we have seen is that Russia is looking for excuses or reasons to continue and even escalate its aggression against Ukraine. We have been there as part of Operation Unifier, training and supporting Ukrainian soldiers and the Ukrainian military. We've been there with supports in many different ways, and we will continue to be. The decisions that we take will be based on what is best for the people of Ukraine and what is best towards keeping peace globally as long as we possibly can.
Antagonize the Russians? Is that-
We're looking at many different factors when we make decisions on how to best support the people of Ukraine. The bottom line is we will be there to continue supporting the people of Ukraine through multiple levels and layers of support.
Okay, we're going to go to Global News, then Radio Canada, then we have Canadian Press, then we have the Winnipeg Free Press, and then we have the Star, and we have 5 minutes left.
Hi, Prime Minister. Mercedes Stevenson, Global News. Canadian Special Operations Forces have deployed to Ukraine to look at options for supporting the Ukrainian government, as well as embassy and personnel evacuation if it gets to that point. What are some of the options you're hearing in terms of possible support, and are you concerned about your ability to evacuate that embassy and the Canadian military personnel who are on the ground?
Obviously, we are extremely concerned with the rising aggressive moves by Russia against the Ukrainian people, against Ukraine. And therefore, as an ally and friend to Ukraine, we will be there and continue to be there to support them and to work diplomatically with all of our allies around the world to encourage and insist that Russia not continue its escalation and threats of violence. It is important and responsible that we be planning for multiple contingencies. And while I won't get into operational details, I can tell you that the Canadian Armed Forces, the Canadian Foreign Service, our multilateral partners, we're all looking at a range of possibilities and contingencies to make sure that we are best able to keep people safe and support the Ukrainian people.
Op Unifier is set to expire in March of 2022. You've tasked Minister Anand with re-upping that. Why haven't you already made that commitment, and will you make it here today?
As you well know, for many years we have been supporting Ukrainian military through Operation Unifier, a training mission that involves about 200 Canadian troops there on the ground. I visited them a few years ago to see the great work they were doing. It is a continued commitment that we have, and when there's an announcement to make on extension, we will be making it.
Bonjour, Monsieur Trudeau, Laurence Martin.
Hello, Mr. Trudeau, Laurence Martin, Radio Canada. I'm trying to understand. Do you fear there will be armed conflict? And if so, why are you waiting to send arms? Answer, yes, we do fear an armed conflict in Ukraine. We're very worried about the position of the Russian government, what they're saying, and the fact that they're sending soldiers to the Ukrainian border. This is a concern shared by our allies around the world and by the Ukrainian government as well. That's why we're there for Ukraine. We'll continue to be there as an ally and partner of Ukraine. We're working with our allies around the world with the support. We'll continue diplomatic efforts. The more sanctions are being announced. We're supporting the Ukrainian army. And we, our work is to respect the free choice of Ukrainians for democracy. With regard to tests for athletes arriving in Beijing, we understand these are very sensitive tests, and people who have recently contracted COVID must isolate for many weeks. Will you be intervening with Beijing? Answer. We understand how important it is to ensure that our Canadian athletes in Beijing are healthy. We knew that We know, therefore, that there are health measures necessary to protect them. They must be the right measures, however. We want our athletes to be protected from exposure to the virus by other athletes. So it's a good thing then that there are measures, health measures in place, and we'll be following up on these tests.
Go to the phone lines.
Prime Minister Mike Blanchfield, Canadian Press. Following on some of the questions Kevin was asking a moment ago, finance officials said last month that the figures in the fiscal and economic update were based on projections that COVID would be on the wane by April. Now we have Omicron. Is that still the timeline for the government that the government is following, that you view the COVID-19 pandemic becoming endemic? Can you comment on that?
Every step of the way with COVID, we've been preparing for a range of scenarios. Obviously, everyone hopes that it is going to be on the wane. Everyone hopes we're going to be able to get back to all the things we love as quickly as possible. But as we saw with the Omicron wave, it is going to continue to present challenges over the coming times, and we have to be ready to adjust. The one thing that we are steadfast on as a government is we will be there to support Canadians with whatever it takes for as long as it takes. And it's not just about making sure that we're keeping people safe from COVID. It's also, as we saw through the first waves of the pandemic, that being there to support small businesses, workers, families, seniors, young people, is actually not just about supporting the health outcomes, but supporting the jobs and the return to normal of the Canadian economy.
Last week we saw the mix-up on cross-border truckers and vaccine requirements. It took more than 12 hours for the government to correct its position on the vaccination status of American truckers coming in. What happened there, and what impact will this have on the supply chain as Canadians see perhaps fewer groceries on shelves, et cetera?
I'll turn to the health minister for discussion on this, but let me remind people that we have been clear for many, many months, since back in November, that the exemption for truckers to not be vaccinated would be ending in January. We have been consistent on that. There was a miscommunication from an official last week that contradicted that was quickly corrected. But trucking companies and logistic companies have known since November that this was coming. On top of that, the U.S. Is moving forward in the coming days with an identical mandate to ensure that truckers are vaccinated on international travel as well. So we are aligned with them. We know how important it is to ensure the free flow of goods and services and essential produce across the border. This is something that we've been concerned with and attentive to since the very beginning of this pandemic. We shut down the Canada-US border for the first time in history to non-essential travel. But we were able to keep the essential flow of goods, medical supplies, of food flowing back and forth across the border. We did that for well over a year. We will continue to make sure that we are getting what we need in Canada while, as always, putting the safety and health of Canadians as our top priority.
And I will just add that not only was this very clearly stated, but that was the right thing to do. As we all know by now, getting our supply chains operate and sustainable and as risk-free as possible is about protecting the industry, businesses, and the workers. The only way to go through this crisis is to lead to universal vaccination, and that, as I said, is not only the right health policy, but also the right economic policy.
Okay, operator, over to you. Thank you.
Thank you, merci. You may press star 1 if you have a question. Vous pouvez appuyer sur étoile 1 si vous avez une question. La première question de Mélanie Marquis, La Presse.
First question from La Presse newspaper. Thank you very much. Hello, Mr. Trudeau. I'd like to follow up on questions asked by my colleagues with regard to Ukraine, first of all. If ever a conflict breaks out, and this is what everyone fears will happen, what will be done with the Canadian soldiers who are currently serving NATO in Latvia and Ukraine? Will they be repatriated to Canada? Answer. First of all, we're in Latvia to defend the Baltic states, Latvia, Lithuania, and Eastern European states from any incursions by Russian forces. Will continue the important work that NATO is doing to protect its eastern front. With regard to Ukraine, we are there to provide training. We've been present in Ukraine. Our forces have been present for many years. I've visited the soldiers in the field. They're doing a great job with the training the Ukrainian army, that is. We'll be making decisions based on the changing situation, based on any actions that Russians or others may take. We have plans for various options, but I don't want to go into them right now. Follow-up question. Currently, with regard to China and the coming Olympic Games, I know that the question has already been asked, but do you fear that Canadian athletes will be particularly targeted by China, given that our current relations are strained with this country? Do you think that that China will target Canada in particular and Canadian athletes? And could you please react to this allegation that they may be doing so? Answer. First of all, I hope that China will allow the Olympic Games to take place and that athletes from all countries, including Canadians, can be their best and celebrate this sporting event that brings people together from around the world. We will always be there to support our athletes, and we expect our athletes to be bringing home medals. We'll continue to ensure that they can have the opportunities they need to succeed. With regard to diplomatic issues, China may choose to be more active or proactive with regard to diplomatic measures, perhaps a little more aggressive. We will continue to respect international rules and the rule of law, and do our work internationally to ensure there are economic opportunities for all.
It's from Christy Kirkup from the Globe and Mail. Please go ahead.
Hello, good afternoon, Prime Minister. Your party promised back in 2015 to cut back on the use of consultants. So I'm wondering, how do you explain the fact that spending on outsourcing contracts has increased by more than 40% since then? And how do you explain the sharp increase in federal money flowing to McKinsey since the Liberals formed government?
I think one of the things that we're always looking at is how to make sure we're delivering the best possible services to Canadians, how we're modernizing our functions, how we're supporting the public service with all the best practices and supports for them, and that we can move forward. On that, there is tremendous capacity within the public service, but it is normal and to be expected that we would also need to turn to outside experts for further help on improving the efficiency and the delivery of services to Canadians. We will continue to make sure that we are having Canadians' backs, that we are supporting them, including through unprecedented times of this pandemic, and that is work Canadians expect us to continue to do.
And Prime Minister, do you support the opposition's request for the Auditor General to review the government's outsourcing contracts, particularly as it relates to McKinsey?
The Auditor General does extraordinarily important work in Canada in reviewing and advising governments on how to do even better by serving Canadians. I welcome all the work that she will do in many, many areas to help us continue to serve Canadians as best we possibly can.
Thank you, merci. La prochaine question est de Olivier Ferron.
Next question from TVA News. Go ahead. I'd like to hear you with regard to data published by the National Institute of Health, Public Health in Quebec. It says that Canada ranks 5th with regard to COVID-related deaths. That's Quebec's position compared to worldwide data. The interpreter is having difficulty understanding the question because of sound problems. Answer. First of all, I'd like to emphasize to what extent it's important that we continue to do our work together with the provinces and territories and other governments. We have been here to help Canadians, Quebecers, 8 out of every $10 spent during the pandemic on help came from the federal government. When we're talking about investments in healthcare, in addition to the $43 billion transferred to provinces and territories for healthcare every year, we spent another $63 billion for this pandemic on vaccines and additional health transfers to the provinces and territories to help them manage this crisis. It's so important to ensure that the data is collected in harmoniously so that there is consistent, comparable data regarding this pandemic and how each region of the country has reacted to it. We were just speaking about data collection and strategies with the provinces and territories. In fact, we need to be present for provinces that are facing particularly difficult crises, and we know that Omicron has been very hard on Quebec and its healthcare system, and the federal government will continue to be there to support as need be. Follow-up question. I'll follow up with a question on the Castonguay report. On the first wave, there were countless deaths in Quebec. I'd like to hear you. The sound is very difficult for the interpreter to understand. Should there be national standards with regard to health? Answer. Seniors across the country deserve to have the best possible health care. That's why we're working with the provinces to ensure that seniors' health care is consistent across the country for all Canadians, no matter where they are located, that they have the best health care possible. But I would be pleased to let our health minister follow up. Minister Duclos, thank you very much. Canadian government has been collaborating with the provinces. We know that there have been many deaths across the country related to COVID, but among the G7 countries, we are ranked second in terms of protection of people and with regard to our mortality rate. If we had the same number of deaths in the U.S., we would have had to multiply our mortality rate by 3. As for working with the provinces and territories, it's clear that this crisis has been very difficult for seniors, particularly in Quebec, where 80% of the first wave deaths took place in long-term care homes in that province. 80% of the deaths in that province, rather. The Canadian government made a commitment during the campaign, and the Liberals said so well before the campaign, that we are committed to working with provinces and territories, working to protect our seniors, no matter where they live in Canada and no matter what their living conditions are.
The last question is from Brian Platt from Bloomberg News. Please go ahead.
Hi, Prime Minister. I just wanted to go back to the answers you gave earlier on the inflation rate. And just so I understand, are you saying that despite inflation being at a 30-year high, you are not pulling back on any of the stimulus spending your government has planned over the next few years?
When we put forward our budget a year ago, we included specific stimulus spending to move forward to get out of this pandemic. That continues, but it was stimulus spending that would decrease as the economy picked up again, and we've demonstrated that our concern for fiscal responsibility is continuing to be a priority for us. We will continue to look at a decreasing rate of debt to GDP in this country. We came into this pandemic with one of the best records in terms of our fiscal balance book, and we put that to work in terms of supporting Canadians through this difficult pandemic, both on the health side, but also on the economic recovery side. We're going to continue to make sure that we are keeping Canada's balance books healthy, while at the same time being there to support Canadians, because indeed, supporting Canadians through this crisis, supporting workers, supporting seniors, supporting small businesses, leads to better economic growth and performance once we're through this pandemic.
The other new spending was laid out in your election platform. In the PBO report today, it's estimated that will require a further $50 billion in new spending over the next 4 years. That hasn't been budgeted yet. So again, with a soaring inflation rate, are you not concerned that this new spending might actually hurt the recovery?
We know that this inflation that we're facing right now in the country is part of a global inflation challenge linked to supply chain disruptions, linked to impacts of this global pandemic. But we are continuing to work to support Canadians through this challenge. Families are facing real issues in terms of groceries, in terms of housing, in terms of a range of things, which is why our announcement of historic investments in childcare last year is actually delivering for people in a number of provinces, in Nova Scotia, in Alberta, in Yukon, and other places where they're already seeing cuts in the costs of healthcare, which is helping families to the tune of hundreds of dollars a month. And we're going to continue to work to bring down costs for families in housing, in childcare, in a range of things. These are important things to make sure we're continuing to have Canadians' backs, as we promised from the very beginning of the pandemic. Nous sommes évidemment
We're obviously very concerned about this worldwide inflation trend caused by the global pandemic, but also by supply chain problems. We will be there to help and support Canadian families, seniors, workers. We've transferred $6 billion for childcare to the provinces, including to Quebec. That will help reduce families' monthly costs, but we've also invested in housing and elsewhere, because we know that supporting people is the best way to get through this pandemic and the best way to have a strong economic recovery for all.
Thank you so much.